Okay, now I'm not sure if you've been paying any attention to the news lately, but there's been this thing called the coronavirus. It's been a very big deal. And this week marks a year since it got its official name.
The deadly strain that's now responsible for more than 1,100 deaths, mainly in China, has been given an official name: COVID-19.
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 The name is a contraction of Coronavirus Disease 2019.
Yes, hard to believe that before that we just referred to it as SARS-2 electric booger flu. Okay, so celebrate's the wrong word. To mark the occasion of the first anniversary of COVID-19, I thought it might be a good time on this episode to look back on a year of predictions about the pandemic and see what the media, health officials and politicians got right and what they got wrong. Anyways, let's start by going all the way back to the very beginning. Over my summer holidays, I went through my vast news recordings collection, and I think I managed to find the very first mention of the coronavirus on Australian TV. Now, this clip is from the ABC News channel. It was during the day on January 10th, 2020. Now, as we watch it, let's see what they got right and what they got wrong as we play along with my new favourite game, Pandemic Predictions.
The World Health Organization says a mysterious new virus detected in the Chinese city of Wuhan is likely to be from the same family that produced the deadly SARS and MERS outbreaks.
The virus has been identified as a coronavirus in some of the affected cases. There's still a lot of work being done to try to work out exactly what this coronavirus strain is. It doesn't appear at this stage to have had any of the concerns about there being any person-to-person transmission of this virus. And there also doesn't appear to be any mortality linked to any of the cases that have been affected by the virus.
Oh, so close. Yes, the ABC, they're receiving -1 point with its January the 10th coronavirus predictions. Now, the very next mention I could find was from SBS World News 2 nights later on January the 12th. Let's see how they went.
Perhaps the single most reassuring fact about this outbreak is that there is no evidence yet that the new virus has spread from one person to another, say Chinese officials. But just how fast is the new virus spreading? So far, not very, say Chinese officials. While there have been over 40 cases in December, medics haven't seen cases rise since.
Oh, yes, SBS World News receiving -3 points there. Oh, how little did they know. Now, believe it or not, the very next mention I could find on Australian TV wasn't until a week later on the breakfast TV show Sunrise, of all places. Now, have a look and tell me if you think they placed the coronavirus story in the right position in the news lineup here. Have a look.
There are fears a deadly illness could soon hit Bali after a second case was reported in Thailand. The mysterious SARS-linked virus has already claimed 2 lives in China following a breakout in Wuhan. Indonesian authorities are now screening all visitors who enter the country. A remarkable video of a toddler riding a hoverboard has sparked fierce debate online.
Oh, yes, I would have loved to have been at the Sunrise Rundown meeting that morning. So do you think we should put the kid riding the hoverboard before or after the deadly mystery illness? What do you guys think? Yeah, end on the hoverboard story? Yeah, I agree. Yes, the Sunrise hosts did show some concern, at least, for their holiday plans.
Fairly frightening turn of events there, but something we'll be keeping across.
I know, just terrifying. Another thing for you and I to be paranoid about, health-wise.
Not going to lie, I've scrapped Bali off my travel to-do list this year.
Add it to the paranoia list.
Why do the Sunrise hosts have a paranoia list? Why are they paranoid all the time? Are they just sitting around smoking bongs with Koshi and getting paranoid? Did you see the kid on the hoverboard? Crazy, man. It wasn't long before daily government press conferences made TV celebrities out of our public health officials. They became as big as MasterChef hosts, but with better hygiene practices and less wage scandals. Now, here's one of the first times we saw Chief Medical Officer Dr. Brendan Murphy on our screens. This is on January the 28th. Now, join us and play along as we play Predict the Pandemic with him.
The main message that we're trying to give still to the Australian public is that there is no cause for concern in the Australian public. There is no human-to-human transmission of this virus. And it's important to note, because we've had some media about masks today, there is no need for the Australian public to wear masks. The medical advice and the World Health Organisation advice is that complete travel bans are not an effective additional measure. All of the previous experience with these coronaviruses is that people are only infectious when they're symptomatic.
Oh, geez. Chief Medical Officer Brendan Murphy there on January the 28th, 2020, getting -5 on Predict the Pandemic. And just imagine if, like, say, the Chief of the Army was that wrong on the eve of a major battle. Oh, guys, there's no risk of the enemy's bullets killing us. There's no need to wear that bulletproof armour. The guns don't even shoot real bullets. Look, it's very weird to look back on how little we knew at the time and how naive we were. And indeed, how overly confident we were in our own self-containment measures. Here's Dr. Brendan Murphy again on April 24, basically bragging about our hotel quarantine system.
Because we are now quarantining formally every return traveller, the opportunity for a return traveller to infect locals is essentially zero.
Okay, now let's check in 2 months later with Victoria and see how that hotel quarantine system went.
At least 50 cases can be traced back to the quarantine hotels where security staff broke the rules.
Of course, we all sadly remember how Victoria's second wave spiralled out of control from there. A week later, on July 6th, Victoria had 127 cases. Across the border in New South Wales, they had only 10. And luckily, that's when the interstate borders went up.
Good evening. First tonight, we are about to take an extraordinary new step in the battle to stop Victoria's second wave of COVID-19 from hitting New South Wales. From midnight tonight, the border between the two states will close.
Victorians are now effectively living on an island, cut off from every state and territory in the country.
Yeah, I mean, Wodonga really wasn't worth visiting before you needed a permit. Now it was really not on my list. And then, less than a month later, on the 2nd of August, the daily numbers in Victoria had sadly increased fivefold.
The state reported 671 new cases overnight. New South Wales recorded another 12 infections.
Of course, it seems obvious with hindsight that the closing of the borders is really what stopped the second wave escaping out of Victoria. And luckily, the other states were not subjected to the hundreds of deaths or the 111-day lockdown that Victoria had to endure. And so a month later, on September the 3rd, a day in which Victoria recorded 113 new cases, what did Scott Morrison call for? That's right, the borders to reopen.
Australia was not meant to be closed. Australia was meant to be open, Mr. Speaker. Australia must become whole again, Mr. Speaker.
Geez, it's good we didn't listen to that guy. Look, obviously, advice was going to change throughout the course of the pandemic. Like in April, when Scott Morrison told us not to wear masks.
On the wearing of masks, the medical expert panel, we accepted their advice that it is not recommended by the expert panel that they are necessary to be worn. And importantly, it's important to note that the wearing of such a mask does not protect you from infection, but if you are displaying respiratory symptoms, then it is at best a measure that prevents you transferring it to others.
Geez, it's good we didn't listen to that guy. That advice was a bit like saying men don't have to wear condoms because there's no chance they'll get pregnant. On the same day he said that, April the 24th, which was when we were still emerging from the first wave, Scott Morrison also decided this was a good time to call for aged care to open up.
Aged care homes have been given an ultimatum to relax strict rules against family visitors or be forced to.
The PM issuing this warning.
We are not going to have these as secret places where people can't access them. They must. And we want to make sure that these facilities are open to their loved ones to be able to go and visit and to continue to go and engage with them.
Geez, it's good we didn't listen to that guy, because you know what was on the news the exact same day?
A 96-year-old woman has died at the Newmarch house in Western Sydney, the 5th death at the aged care home.
Yeah, that's right. Scott Morrison was calling for aged care homes to be opened up at the exact same time as the Newmarch house outbreak was well on its way to becoming probably the most deadly outbreak in New South Wales, with 19 residents losing their lives, almost a third of New South Wales COVID deaths to date. And it didn't stop there. At the same press conference on April the 24th, Scott Morrison insisted that schools were safe to reopen without social distancing. Which is ironic, because I thought the Liberals hated safe schools.
In other news, the Prime Minister insists social distancing rules don't apply in school classrooms.
He hit out, all but telling those who want social distancing in classrooms to back off.
The 4 square metre rule and the 1.5 metre distancing between students during classroom activities is not appropriate and not required. I can't be more clear than that.
Oh, hey, and speaking of bad advice, remember when Scott Morrison told us the best way to stop the pandemic was to download an app to our phones?
The federal government has launched its contact tracing app, which it insists is crucial to control the spread of the disease.
Download the app. That is Australia's ticket. Download the COVID Safe app.
Download the app today.
Download the COVID Safe app.
Downloading the app.
Download it.
Okay, how did that go?
Labor says the app is a failure after it picked up just 17 contacts.
$17 million has been spent tracing just 17 people not found by contact tracing teams.
That's such bad value for money, even the people behind Quibi were like, nah, that's too expensive. Even our Reno 911 reboot got like 19 people watching.
Only on Quibi.
Yeah, and geez, it's good we didn't listen to Scott Morrison on lockdowns either.
We can't expect there to be no cases. That's not success. Because what success is that we live alongside the virus, we deal with the challenges that come along, we keep opening up the economy, but as long as we are closed, we cannot claim success as a country. If we are shut, we are not living alongside the virus is actually keeping us from living. That demonstrates, I think, in New South Wales how effectively your states can respond to this. And the best protection against the virus, to live with the virus, to live alongside the virus, and to open up your economy. You don't protect your economy by continually shutting things down.
Since then, Brisbane, Adelaide, Perth and Sydney's northern beaches all endured some short, sharp lockdowns by their premiers to stop the virus spreading. And it worked. Which predictably meant that the PM stated last week that of course he's always been in favour of these lockdowns.
Right from the outset of this pandemic, it had always been my view that localised lockdowns were a good way to suppress the virus and its spread through metropolitan areas.
Look, of course, a lot of things have changed over the past year as new information and strategies have come to hand, including our entire overall strategy. When the pandemic first hit in March and April, we adopted a strict suppression strategy, basically trying to flatten the curve to make sure there was enough capacity with hospitals and ICU beds.
Eliminating the virus is not considered an option. The task instead, managing the infection so that those who need intensive care can get it.
But then in July, after the Melbourne outbreak, it subtly changed.
A meeting of National Cabinet reaffirming Australia's suppression strategy with the ultimate aim of no community transmission.
The National Cabinet's position has always been an aggressive suppression strategy, and that remains our view, and it's certainly the view of my government. The goal of that is obviously, and has always been, no community transmission.
Now, how this is different from New Zealand's elimination strategy, I'm not sure, but we didn't want it to sound like we were copying New Zealand, because God knows we already have enough fights about the ownership of crowded house pavlova and flat whites.
Elimination doesn't mean zero cases. It means zero tolerance for cases. It means when a case emerges, and it will, we test, we contact trace, we isolate, and we do that every single time with the ambition that when we see COVID, we eliminate it.
And look, in my opinion, I'm not a scientist or immunologist, I'm just a hobo with a podcast, but this change of strategy from suppression to basically elimination with a slightly different name has really served Australia well. I mean, look at Canada. They're still going under a suppression strategy, for instance, but they've allowed thousands of cases per day, and it's resulted in over 20,000 deaths, over 20 times the number in Australia, despite them having a very similar population size. And on top of that, the big cities have had to endure painfully long second lockdowns and curfews, resulting in the closure of lots of small businesses.
Toronto locked down longer than anywhere else in North America.
More than 20,000 Canadians have lost their lives to COVID-19.
It's the absolute worst of all worlds. It's like if Justin Bieber and Celine Dion and Nickelback were all touring together. It's the absolute worst thing you can think of. Look, there's no doubt that Australia's response to COVID-19 over the past year is absolutely world-beating and something that we should all be proud of.
What success is that we live alongside the virus.
Not you. Look, Scott Morrison is going to try and spin it as if it's all his doing and take all the credit for it heading into the next federal election. But ultimately, I think it was more a result of our state premiers taking action. I mean, let's not forget that it was the state premiers that basically shirt-fronted the PM into us having our first national lockdown back in March by leaking their plans to journalists in the middle of the Prime Minister's press conference right before they were due to have a national cabinet meeting.
Actually, just received the text message saying we've just broken the news that New South Wales and Victoria are pushing for a total shutdown of all non-essential business, so a statewide lockdown and school closures from Tuesday.
It's fair to say that Scott Morrison was completely blindsided by those announcements.
We have New South Wales and Victoria pushing behind the scenes.
It's hard for the Prime Minister to look like a leader when the states start to go it alone.
But ultimately, I think our impressive pandemic response has largely been a result of the state premiers competing against each other for who could have the lowest case numbers in the safest state and happily sledging each other about it the whole time.
Interstate rivalries intensify as the relationship between the New South Wales and Queensland's premiers hits a new low.
We'll just let New South Wales be New South Wales.
She is now the victim of a policy that she put in place herself.
I just urge the New South Wales government and people in New South Wales to look outside of New South Wales of what other states and territories are doing in order to crush and kill the virus.
It was kind of like rugby league state of origin, except with all the states competing, a few less concussions, but as usual, ignored by the entire world's media. So in conclusion, geez, it's good the state premiers didn't listen to this guy.
You don't protect your economy by continually shutting things down.
Australia was not meant to be closed. Australia was meant to be open.
We can't expect there to be no cases. That's not success.
Newsfighters, Australia's funniest news summary podcast.